Hello, this is SkyCushion9, and welcome to Transsistance, a series of videos that talks about many of the topics involved with transitioning, from the point of view of a future medical student and a male to female transsexual. Over the course of these videos, I will help describe the physical, medical, and other aspects about transition, ranging from the anatomy involved, to hormone replacement therapy, to the various surgeries. I hope that with this series of videos I can help educate both transsexuals who are considering transitioning, as well as those who would like to just better educate themselves about an important event and undertaking in the transsexual world. With that, let's get started. As it has been alluded to in the previous topics, the changes associated with hormone replacement therapy are slow coming, with most changes not peaking until 2 years after the first dose, and even then, those changes are almost never very pronounced. As a result, transsexuals typically resort to more directly physical measures to present as their desired gender. Ultimately, one thinks towards surgery as the ultimate tool to accomplish this. However, it is not the only tool at one's disposal. There are a number of techniques and procedures that can be done to improve one's passability without ever going under the knife and having to deal with the wondrous world of health insurance. In this video, I will talk about 4 such items that are often done in the transsexual world, and discuss both how to accomplish them properly, as well as the medical side and issues of them. As a disclaimer, this video will not have all of the major non-surgical techniques available to a person, and focuses more on those with possible and known medical issues. So if you desire more options, hop onto your favorite search engine and look away. Or better yet, suggest items in the comment section below. Otherwise, I will talk about what appears to be the big 4. Male to female technique number 1. Tucking. As far as presentation is concerned, the major item that male to female transsexuals focus on is hiding their genitalia, as the telltale bulge is the quickest way of having yourself outed. Since this is an issue that can't be dealt with until a person undergoes surgery, a transsexual must find a way to hide it, and the most effective way of hiding the penis is by tucking. During development of the reproductive system, the testicles descend down from the groin, through the inguinal canals, and into the eventual scrotum. However, these inguinal canals do not fully close after development. Therefore, it is actually possible to temporarily push the testicles back into these canals. Then, by tucking back the penis towards the anus, a person can produce a flat appearance of their groin and present more as a female. As just recently stated, one starts tucking by gently pushing the testicles towards the proximal end of the body, i.e. towards or into the body. Many people often suffer injury by forcing them upwards too hard, so it's important to take it slow if you're just starting out. If it feels like you are encountering a lot of resistance, you may be doing it wrong. Many people start by attempting this while lying down, but as you become more familiar with the process, it can be done theoretically anywhere. After the testicles have been pushed up, the penis is pulled back, now across the empty scrotum, towards the anus. After this is accomplished, it needs to be held in place in order for it to work. Many people can rely on medical tape to tape the penis back, although it will be ineffective if the points the tape are attached to are hairy. But at the very least, a constrictive undergarment will be needed to keep things stable. An item known as a gaff is the most effective in this category. However, you can also manage with tight underwear and panties as well, as long as you double layer. However, tucking should be considered a technique along the lines of wearing high heels. It accomplishes the desired physical change, but is a position that the body can only handle temporarily, otherwise you'll harm yourself. The testicles will be the source of the most of the pain due to added pressure, and serious urethral issues can develop if one tucks too long too often. Tucking should only be done a few hours at a time, and activities such as sitting and running can put added pressure on the site if the tuck doesn't become undone. It is also difficult to urinate while tucked, so you will have to undo your tuck whenever you go to the bathroom. Male to female technique number 2. Voice training. The next major issue when passing as a woman from male to females is their voice, which can be as outing as the visible bulge itself. Surgery on the voice box has been talked about for quite some time recently. However, many male to females have more general options to produce a more feminine voice. The professional method of addressing this is to undergo voice therapy, where a person essentially is trained by a special linguist to produce both a feminine pitch and resonance, as well as talk in more feminine defined patterns such as a non-monotonous tone and submissive wording. However, it is possible for a person to teach themselves. The biggest challenge is to find the proper pitch at which to talk at. Many people are tempted to talk in as high a pitch they can manage. However, a falsetto voice is often very broken and squeaky, and thus ineffective, not to mention it makes you look silly. There is a lot of information online on how to find a male to female voice, but there are two techniques that I have learned that can help you reach that feminine voice. First off, with the pitch. An easy way to find the right pitch is to tilt your head back like you're gurgling. Once you have your head in this position, produce the highest note you can manage. This head position prevents you from the high falsetto range, but should still produce a relatively high tone. Once you have memorized this note, reach the note just below your max note. This should be the pitch that you should aim for whenever trying to talk. Second, resonance. I might not describe this properly, but the major difference between how men and women talk is that men talk from their throats, while women talk from their head. What this means is that where the breath is coming from, basically. By talking from the throat, men take full advantage of their thicker vocal cords. Speaking from the head, as it were, produces a more whispery tone and a more feminine resonance. It will take some practice to realize when you're speaking from either or, but it is very manageable. Again, with tucking, it's important to take things slow, as your throat can suffer a bit if you try too hard. It is initially hard to keep in the perfect pitch range. However, with practice, a feminine voice can become second nature to a male to female. Technique number 3. Electrolysis. While this can be done by either transsexual, hair removal tends to be a topic dominated by male to females, and the most effective way of doing this is through electrolysis. Electrolysis is a process that involves the use of electrical charges in completely killing hair follicles in the skin, so that hair won't regrow, something not possible by things such as shaving or tweezing. Modern electrolysis has evolved leaps and bounds over the past few years, and many places now offer laser hair removal, which uses light to essentially burn follicles, or an electricity-laser combination electrolysis. While laser hair removal tends to be a more popularized method in today's society, it typically isn't as effective. For one, laser hair removal tends to be effective only if you have light skin and a dark hair tone, so African descent individuals or blondes tend to have poor results. Also, laser hair removal is rated by the FDA as the best permanent hair reduction procedure, while electrolysis is the best permanent hair removal procedure. However, electrolysis tends to take longer to perform. Still, some electrolysis locations have begun using machines that use a combination of electrolysis and laser, getting the best of both worlds with minimal side effects. To find out what works best, talk with an electrolysis provider. Either way, a side effect of electrolysis in laser hair removal tends to be simply pain, which only lasts a few minutes after a session, although improper electrolysis can alter the pigment of the skin, and both have a risk of blinding, although that's only an issue if you're targeting hair on the face. A person in either case will have to go through multiple treatments, as hair growth goes through cycles, and hairs have to be treated at a specific point in the growth cycle to have an effect, which is never possible in 1 or 2 treatments alone. Male and females typically undergo electrolysis to remove facial hair. However, many surgeons recommend that genital electrolysis be done as well, in order to reduce the amount of hair down there as much as possible. The reasoning is that when a male and female undergoes sexual reassignment surgery, the hairs in the skin used will still be there, and too many could pose a serious risk of infection through ingrown hairs. Technique number 4, and female to male technique number 1. Binding. Whereas the male crotch bulge can give away a male to female, the female breast bulge can give away a female to male. Therefore, many resort to the art of binding. Binding is very analogous to tucking, as it involves a part of the body that cannot be reduced until surgery, and involves flattening out the region to improve chances of passing as the desired gender. However, binding is much simpler than tucking, as it does not involve inserting a specific mass strictly into your body. As indicative as the name can be, females and males use a certain restraining garment to flatten the breasts as much as possible. The first item that many female and males fall back to initially is the only commercial product that could accomplish such a feat, an ACE bandage. There are ace bandages that exist that are designed for chests, being a loop of a fabric essentially. However, the downside associated with this avenue is that ace bandages tend to be too tight and can cause harm if worn too long. The female-to-male community, as a result, begun making its own kind of chest compressor, aptly named binders, that accomplish the same feat as a chest ace bandage, but tend to cause much less harm. However, these are typically only available over the internet. Whichever is used, application is simple, as the person only has to slip it over their breasts. So there's no complicated process like tucking. In any event, like tucking, binding should not be done for prolonged periods of time, but it is feasible to believe that one could get away with binding for longer than tucking. Also, it should be noted that female to males who are well endowed will also have limited effectivity with binders. Still, this is typically the only way of reducing breast size prior to a mammectomy, so many bind as a direct result. It should also be noted that male and females can bind as well, though this is typically done only because a male to female is not ready to start presenting as a female, but has begun hormone replacement therapy and has experienced noticeable breast growth. Beyond these techniques, if a person desires further physical alteration without surgery, then special garments or plastic items are used to produce a more appropriate body image. Male to females can purchase false breasts and hip pads to produce a curvier shape, while female to males can purchase non-erect plastic penises to produce the male bulge, a practice commonly referred to as packing. However, using these items tend to have minimal medical effect, so I won't touch more on these than I just have. If a person desires further changes than what was just discussed, or would just rather not have to deal with tucking or binding, then the only other recourse tends to be surgery, which is what the following video will finally start touching on. So this is Guy Christian 9, this has been Transsistance, and in the next episode, we shall start touching on the surgical procedures involved with transitioning. I'll see you then.